Good day, I'm Dr. Ebony Lambito Alisa Devesa, and now we will be discussing another topic about mental health. So it's about vices, okay? So more specifically regarding cigarette smoking. So, well, it will be tobacco use disorder. So when we say tobacco, it's more of cigarette. Okay, we are banning actually cigarette smoking. So, but there are still a lot of people who are smoking, less of alcohol use disorder, but more of tobacco use disorder. So, cigarette smoking actually affects our health. You know a lot of things about that. So, what are the contents in a cigarette? So, here it is. There are a lot of chemicals here, as you can see, that are very poisonous to our body, such as, well, as you can see, like butane, but almost all of this that we are actually using, and some of these are not actually edible, and you don't take in those chemicals because it is actually toxic to our body. Okay, so there is methanol, carbon monoxide. Okay, so nicotine is actually a colorless, rapidly acting toxic substance in tobacco that is one of the major contributors to the ill effects of smoking. It is used as an insecticide in agriculture and also to kill parasites in veterinary medicine. So ingestion of large amounts, okay, causes salivation, nausea, vomiting, diarrhea, headache, vertigo, slowing of the heartbeat, and in acute paralysis of respiratory muscles. Okay, as you can see here, there are a lot of substances or chemicals that is in the cigarette that are actually carcinogenic. That means it can cause cancer. So aside from causing physical illness, like debilitating and causing death, early death, okay, premature death to a lot of people, especially those who are affected, and most likely not only active smoker but also passive smoking, okay. There are a lot of carcinogens inhaled by passive smokers, okay. When we say passive, that means you're not the one smoking, but you're the one receiving the chemicals that is from cigarette smoking. Okay, when we say tobacco use disorder, that means there are criteria for that. So you are actually taking in cigarette, okay? You're smoking cigarette and there is tolerance. So you have to take a lot of amounts of or sticks of cigarette in order to attain that relaxation. So that is actually one of the misconceptions. They feel relaxed, especially if they have taken or they have done cigarette smoking, okay? So aside from that increase of intake or amount of cigarette, there is also a lot of time thinking about having those cigarettes, okay, using your money, affecting your relationship, your work, or even your mental health. So okay, so it affects your functionality at work, in your relationship at home, and it can also interfere with regards to your priorities. Okay, you prioritize more of your vices compared to other social activities, interpersonal relationships, and events in your life. Okay, so if you have tobacco use disorder, some others also have comorbidities, okay? They are anxious, they have actually anxiety disorders. There is also other who have mental disorders like depression. So, tobacco use disorder is actually not advised, okay? It's prohibited, okay? Because from the very beginning, it affects your health, okay? So, if you really want to have a life that is more productive and you don't want to burden yourself in the long run, then you have to avoid tobacco smoking, okay, cigarette smoking. it's not that easy to stop cigarettes. I have actually encountered a lot of patients who are cigarette smokers and they have difficulty in stopping intake of cigarettes. So just so you know, there are a lot of substance. Actually, not only nicotine, which is from the cigarette, also cigarette smoking, alcohol, okay, coffee, caffeine from coffee, okay. Aside from that, rugby, other cough syrup, marijuana, shabu, or methamphetamine. So there are a lot of substance. But I'm talking about one of the common and taken for granted, which actually affects our health. There are a lot of pulmonary diseases nowadays due to or triggered by this kind of vices. Okay, if you have family members who are having children at home and they develop pulmonary diseases, and they are more prone to trigger asthma attack. Okay, so there is actually if you are aware, there's actually, if we have secondhand smoke, there is third hand. Okay, when we say passive smoking, and then the third receiver is those who have taken those substances through the through instruments or objects, like from t-shirts, for example. Okay, so that's one of the examples. So we go back to the criteria again for tobacco use disorder. So you have dysfunctionality in the family due to that vices. Okay, there is also withdrawal effect. Okay, one of the reasons why there is difficulty of overcoming or stopping smoking cigarette is because of this withdrawal. Okay, nicotine withdrawal. Do you know that there is actually a lot of doses of nicotine per stick of cigarette? That's why it can make you feel relaxed because it affects our reward system. But okay, remember this, nicotine is addicting. Okay, that's why you have the feeling of emptiness after the withdrawal effect, and there are a lot of withdrawal effect that I will discuss later. Tobacco withdrawal, such as irritability, frustration or anger, anxiety, difficulties concentrating, increased appetite, restlessness, depressed mood, and insomnia. And the difficulties of those smokers who tried actually to stop smoking. So one of the criteria for tobacco use disorder is the difficulty of stopping or cutting cigarette smoking. Okay, so remember those criteria because those are actually important for you to know if you have tobacco use. Factor is if there is family member who actually does the cigarette smoking, and if you have encountered or if you have done cigarette smoking during your childhood, it actually increases the risk for you to have cigarette smoking, or you will develop addiction if you are a cigarette smoker at an early age. So if there is actually negative peer pressure with regards to your family, okay, with regards to your friends who are actually smoking, who are the friends of your children, because this negative peer pressure can affect your child to engage in cigarette smoking. Okay, there is actually phases wherein you decide when to stop. Okay, so there is what we call pre-contemplative phase. Okay, you actually don't think that cigarette smoking is actually bad to your health, or it is a problem, or there is actually an addiction already. When we say contemplative phase, then it is the time that you are already thinking that there is something wrong. Okay, there is something wrong with regards to cigarette smoking. So then you take an action. You plan. Okay, first you plan to stop, and then what are the steps in stopping, and then you take action. So those are the phases in order to overcome, okay, your addiction with regards to nicotine, okay? Cigarette smoking is about nicotine. So, nicotine is the substance that causes addiction. So, there is actually misconception that you have to taper off cigarette smoking. Because when you say taper off, you decrease the amount of cigarette. However, there is actually exposure still for nicotine. So that means your addiction is still ongoing and there is still nicotine in your body. So you yearn, okay? You look after the effect of nicotine. I have discussed earlier the effect of nicotine in our body, and when we stop intake of nicotine, what are the effects? First is you have to decide and realize that you can achieve it, okay? Self-determination is important in order for you to stop cigarette smoking. However, we can also help you as professionals in order to overcome what we call nicotine addiction, okay? We give treatment and you ask your psychiatrist, because psychiatrist is also one of the specialization that treats addiction with regards to substance use. What stops you from stopping cigarette smoking is the effects, actually, the effects of withdrawal from nicotine. I have discussed earlier that one of the effects of nicotine is you have actually nausea, vomiting, you know, the feeling of emptiness because of the absence of nicotine in your body, which is an addicting substance, okay? It causes addiction. That's why you feel bad when you stop, okay, nicotine. So if you are actually sure that you will stop intake of cigarettes, so you don't have to taper. You have to stop immediately, okay? No single use. Second, okay, I will explain, okay? If you're taking or smoking 10 sticks of cigarette per day, if you decided to stop, okay, you stop, okay, taking in nothing, okay? That would be 0 sticks of cigarette when you stop, okay? Stop by stopping, not tapering off, okay? Don't decrease the amount, stop, okay? Finally stop it, okay? It will be difficult, but the pangs of withdrawing from cigarette smoking will take some time, but it will be worth it, okay? Your life will be more healthier and you will avoid the nicotine addiction. I hope you have learned from this video, and thank you for subscribing, and I hope you can share, comment below, and thank you for your time. God bless.